So when a patient comes in with a herniated disc, I think it's important to recognize that every patient's very different, has unique circumstances. But if we're talking a standard low back disc herniation with no neurological symptoms, nothing going down the leg, I think straight chiropractic is a fantastic way to get people out of pain, get mobility back up. I do like to use modalities with that as well, generally electrical stimulation or laser. This office has a lot of high-end tools that I can use in conjunction with chiropractic adjustment. And then if there is pain down the leg, then we have a different sort of analysis and exam we need to do. Based on that, we'll use the same tools I just mentioned, but we might throw in decompression. And this place has the best decompression machine you can possibly get, which really makes my job a lot easier, and the patients tend to respond really well as well. Patient comes in with a really severe disc herniation. They may be limping in, they may be crawling in. In such a case, the first thing I usually need to do is get them out of pain to assess how much underlying structural issues there are and or see what their available function is. Once I've done that and got them out of pain, I have a lot of different available treatments. Once we've established more function, then we need to come into corrective exercises and create habits and abilities that are going to protect the back in the long term. There are a lot of situations where surgery and non-surgical intervention kind of overlap. I'm never afraid to send somebody to surgery if they need it, but at the same time, I like to do everything within my power to prevent it. For my herniated disc patients, I do a lot of manual therapy, especially initially. I really like to break the muscle apart, get everything mobile so we can establish how much damage there is structurally, what your available range of motion is, brings you out of pain, and then at the same time this allows me to implement some activities you weren't doing previously. Maybe they're postural habits or exercises that can help strengthen that core to be protective of the spine in the long term. I like to come up with goals along the treatment plan with my patient, things that are attainable, realistic, but also are common goals for us both, whether that's walking from point A to point B or returning to an activity that you used to love. I think creating motivation, sustainable goals really helps keep a patient on track and really gives me specific things to work towards to make them happier, make them healthier. The diagnosis of a herniated disc sounds scary and is often dramatized. Most people deal with low back pain at some point in their life, and many of them have bulged or herniated discs. Coming up with conservative, appropriate approaches to both getting somebody out of pain and then restoring their function and their daily activities is a core part of what I do as a chiropractor and what I do in this practice. I'm Dr. Neibarger, and I hope this was helpful.